Welcome to Modern Aging, the show where we're going to talk about all things that have to do with getting older, which is a topic that not too many people like to talk about, but it's true, it's happening. And today we're going to talk about navigating home care services. So when your loved one needs a home care service, what are some of the key questions that you should be asking? And I have here today an expert on the field. Her name is Sheli Monacchio. She's with Akin Senior Care Services of Princeton, and she's going to answer these questions for us today. It is a pleasure to have you, and I know you've been in the field for a really long time, and you know a lot about home care. What we have some really quick key questions here to ask you today, for our viewers that are considering or will be needing in the future. The key question that I'd like to start with is, what is the difference between home care and home health care? Because I think a lot of people are confused about the two.
They are, and you don't know what you don't know. So sometimes people assume that home care is covered by Medicare, but that is not true. What is covered by Medicare is home health care. And that's after a hospital stay, a qualifying hospital stay, where somebody comes home and they just need a little help. So what they do is they do physical therapy, they do occupational therapy in the home, maybe 2 weeks, a month, depending on the situation. It's for people who are homebound, that really can't go to physical therapy. And the caregiver supplementation there, like what they send for caregivers, is about an hour and a half a day. That's all that's covered through insurance. And the reality is most people need more than that for their loved one or for themselves. So home care is that additional care that you would pay for privately, or it's also covered by long-term care insurance, but it is not covered by standard health insurance and Medicare.
That's really good information, because I think it's always confusing for people. Medicare, Medicaid services. What is covered, what isn't. What are some of the services that one would expect to get from home care service?
So what home care does is non-medical home care. It's ancillary service, right? It's stuff like bathing, dressing, helping somebody, even if they're not actually helping them at that moment. Maybe they're providing standby safety oversight so the person doesn't fall if they're a fall risk. They can prepare meals for somebody who can't really manage that any longer. Sometimes they'll go through the mail and make sure anything junk mail they'll throw out. Sometimes they answer the phone for somebody because there's so many scams out there, and they kind of manage that intake of phone calls and who's trying to reach that client, and providing safety oversight in everything they do. A lot of people think it's housekeeping as well, and really it's based on cleaning up after what the care was.
So Sheli, tell us what is not included in home care services, so this way a family knows what not to expect.
Sure. So a lot of times people ask for medication administration. That is something that a home care cannot do. What they can do is, if the medication is pre-filled in a pill box by the family or by a nurse, they can give them that dosage. They just can't administer medication. If there's a Hoyer lift in the house, safety is an issue for not just the caregiver, but the client. So what happens is it's a 2-person assist for a Hoyer lift. That is something a home care cannot do with one person. It's actually unsafe and against the regulation.
That's very interesting. Tell me, how are these employees certified or trained? How does one hire someone to work in that field, and what are their certifications?
So their license is a certified home health aide. They are certified by the Board of Nursing through the New Jersey Division of Consumer Affairs. So that's where their license is, but their license is approved and active if they're supervised by an RN. So that's why it's important that a caregiver works for an agency, because if somebody is a private caregiver and says they have that license, what's really happening is there's nobody supervising them. There's no RN supervising them at that time. So really the client is the employer.
So Sheli, when someone is hiring outside the agency, because there's a lot of ads in the paper for companion, caregivers, what does that situation look like when they do go outside an agency and hire?
So there's so many risks to hiring privately. We call that the gray market. And it's one of our biggest competitors as a home care agency, which is crazy considering all the risks that these folks are taking. Number one, there's liability risks because the caregiver is not supervised by an RN. They have to be working for a licensed bonded agency to be supervised by an RN. So if they're working privately for a family, there's no supervision. The family is the employer. Now, that means that if they're not paying workman's comp, so what happens if there's an issue? Homeowners insurance does not protect that family. If the client gets hurt caring for their loved one, they're probably not claiming taxes unless somebody has a household payroll. And I will tell you, we work in Princeton. Sometimes people do have a household payroll. That's a whole different thing because they are taking those taxes out and paying workman's comp for their household payroll. That is not typical. So what happens is they're responsible. But that also jeopardizes the client for receiving government benefits because they're going to show this money was paid to a home care that's really not there. It's just a person. So that would be considered a gift when they're looking at Medicaid 5-year lookbacks, veteran benefits, 3-year lookbacks. It could jeopardize their eligibility for benefits.
It's very interesting information because a lot of people do think that if they just hire from outside and they have somebody living in their home and they don't really know this information. So it's really good that we're sharing this with the viewers. When it comes to costs and paying for services, you know, since we did touch on the Medicare and Medicaid, what does that look like? Like who pays for what? How does it get funded? How does that look?
So private pay home care with a licensed, bonded, accredited agency is paid for out of pocket. There are rates that start at $35 and can go up to $50 an hour depending on the level of care, how many hours you have. There is a variable in that amount depending on so many things, but that is a range you can start with. And that's for hourly care. So that means that caregiver is going to be working for those hours that they're hired. If they're on from 9 to 1 or they're on from 9 to 5, they are working that time and they have Board of Labor break entitlement that they can take, and that's all indicated, should be indicated in everybody's service agreements so that the family understands that expectation that the caregiver should have a break. For a live-in situation, it's more of intermittent care when the care is needed by this client. So let's say the person needs help getting up in the morning. They need breakfast, but then they kind of read or something during the day where there's not care given. That is intermittent care. So the caregiver could take a break at that time and have downtime that they don't have when they work hourly. That looks about like a 12-hour day, intermittent throughout the day, and the caregiver should be able to sleep at night. If they're not sleeping at night, it's not safe for that caregiver with no sleep to care for that person during the day on no sleep. The safety factor is a little compromised. So they must be allowed to sleep at night. If not, there are options to put an awake caregiver overnight to relieve the caregiver who's living in.
So, Sheli, what does a care plan look like? How does one expect an agency to come in and establish that plan in the communication between the agency and the family?
So remember we said the caregivers are supervised by an RN. Most home care agencies have a director of nursing, an assistant director of nursing, or a per diem nurse that comes out and conducts an initial assessment. Sometimes companies charge for that assessment, but it's a nominal rate for what they're putting in place, because what they're doing is putting in a care plan by an RN for that caregiver to follow. So the initial assessment happens, and then by regulation, every 30 days, there's a phone call to the family, to the client, or to the caregiver to say, how are things going? Are there any changes that we should know about? In the meantime, before that 30 days, if there are changes, the caregiver will call the agency and will say, hey, we're noticing that Mrs. Smith is more confused lately, or we're noticing that Mrs. Smith can't dress herself anymore, but she was able to till about a week ago. So I just want to let you know there are some changes. So sometimes that warrants another assessment for the nurse to come out and say, hey, maybe we need to increase our care and change our care plan. And then every 60 days, whether there's a call or not, there's an in-person mandatory 60-day reassessment to be sure that the caregiver is providing the correct care to the client and there are no changes that need to be addressed or trained, because sometimes that caregiver needs a little, yes, they've worked a Hoyer lift before, they learned in their school, but they hadn't done it for so long that they may need some retraining on that, or they may need maybe they had clients before that didn't have any medication to do reminders, so they didn't have to worry about that. Or maybe the caregiver, doesn't know that client's routine. So everything is kind of touched on and trained through that assessment time to be sure the expectations are met by the family and by the agency.
It's all really good information. There's a lot more. I'm sure you have some questions of your own. Please feel free to reach out to us. Sheli's information will be part of our directory. If you would like to reach to her directly, you may do so. Thank you so much. Stay tuned for the next segment. We have more information for you.
We are Chefs for Seniors. We make it easy to eat healthy right in your own home. Every week, a friendly and professional chef comes to your home to cook gourmet meals using the freshest ingredients. There are many affordable menus to choose from, and we believe that healthy, nutritious food and a visit from a friendly chef is good for both the body and the soul. So when you are ready to stop worrying about meals, we're ready to help. With fresh, affordable, delicious tasting meals served to you right in your own home. Chefs for Seniors, good food and good company.
We are here today with Chris Kellogg. He is from Nightingale, New Jersey, Eldercare Navigators. Today we're going to find out, what does a care manager do? What is a care manager? A lot of you probably don't know the services available to you. Chris, thank you so much for being here today.
Thank you so much for the opportunity, and I love your studio.
Thank you, thank you. So Chris, we are going to talk about your company and the services that you provide. So tell me a little bit about your company.
Kelly McNamara and I, my business partner, started Nightingale NJ Eldercare Navigators so there was a resource. Nightingale NJ Eldercare Navigators help older adults and those loved ones in their circle of influence navigate the transitions of aging. We're licensed healthcare providers, specialists in geriatrics that are familiar with all local resources. We act as their advocate, guide, and expert. Our mission is to make sure that every elder has their voice be heard, their values honored, so they have their power, control, dignity, and peace of mind throughout the aging process.
That's amazing. So how does one know when they need a care manager?
When does somebody consider themselves old? trick question. No one ever does. We need to be able to make sure that if there is a change of status, it's not, oh my gosh, what do we do now? Or our loved ones, what do they think we want? They want for themselves. It's important to be able to have as much of a mature life plan in place. So we limit that risk of what do we do to we're on a different path. We advocate for having that mature life plan so that we have the optimal, possible, and problematic approach played out throughout the aging process. So there's no surprises.
Are there different qualifications? Are there certifications for one to be a care manager?
So to be a part of ELCA, which is a group that we belong to, the Aging Life Care Association, everyone needs to be a licensed provider. Then there's above ethics, and then there's additional tests involved. One of the most important things is that much like there's financial fiduciaries, they do not take any outside benefits or reimbursement. All of the recommendations that is made through a care manager should be unbiased. What we do is once we make a recommendation after finding out what's most important with the elders that we serve, we make those recommendations and we stay on to make sure what's being promised is being delivered. What we do with Nightingale NJ is we don't speak for the elders that we serve. We amplify their voice. So again, they have their power, control, dignity, and peace of mind throughout the aging process. We give a homework assignment on a single piece of paper. What is their single definition of their quality of life? What gives them joy? Make sure that they get up in the morning when it's cold and raw and all you want to do is maybe pull up the blanket and roll over. That's kind of hard to be able to write that down in one sentence. But on that other side of that piece of paper, I ask, what keeps you up at night? What don't you want to have happen? That starts a spark and people are able to oftentimes clearly say, this is what I don't want. That homework assignment gives us the bookmark to be able to optimize the likelihood and limit the risk of what they don't want. Wishing isn't going to get where they want to go. You need to have, again, a plan. We work for the elders that we serve, but we're able to, we can't make them do things that they don't want to do, but we help them come up with that plan so they have their power, control, dignity, and peace of mind throughout the aging process.
So when you do meet with the family and you're putting a care plan together, what does that look like?
Everybody's on their independent journey. We've learned that sometimes we share similar paths. We do home safety assessments. We can go to doctor's appointments with people. We help them understand what is said, what it means, how does that apply now and in the future, not just to themselves, but everyone in their circle of influence. So everyone has the same perspective. We go to the emergency room if there's a change of status. When somebody brings us on board, they're never alone. You can't beat the system, but you need to have someone that knows the system to make the system work for you. And that's one of the things that we do.
Chris, do your company or does a care manager work with other professionals in other services and that's how you put it all together?
Absolutely. We find out what's most important to the elders that we serve. We make those recommendations, whether it be having home modifications, bringing in outside services like home health aides. I've been doing this for well over 25 years. When somebody needs help at home, I reach out to partners in care. I don't want to hear, well, she's a lovely person or he's a lovely person. What I want to do is make sure we limit that risk of as much on-the-job training as possible, because that person that goes into their house, whether you're a navigator or a home health aide or a physical therapist, occupational therapist, at-home doctor, we're guests in that house. We need to be able to fit into their routine by being a wordsmith, making things be as palatable as possible. We're able to generate what's most important to them.
I see. This is a great service that you do offer. How does one pay for this? How does one fund this service?
Much like attorneys, it's private pay. We work on an hourly rate and bill into 15-minute intervals. Medicare Medicaid does not, but some long-term care insurances pay for that. There's a lot of different types of long-term care insurances. We would bill the family and then we would help them make sure that it's submitted to the vendor so they can be reimbursed.
So if you had an opportunity to give someone a great advice as a care manager, what would that be?
I say a pearl of wisdom is hope for the best but plan for the worst. So that, again, sometimes the biggest gift that we can have is help people understand what's most important to us. Being able to stop saying the word you, with the exception of I love you and thank you. Being able to say I am concerned. Being able to have it be so that the older adult maintains their dignity and their natural role. What we can do is act as that communication conduit so that that adult child comes in, can talk about the grandchildren, not have to worry about medication management, not seeing changes, not having to schedule time away from work so they can go to doctor's appointments. We maintain that role so again, the elders that we serve have their power, control, dignity, and peace of mind throughout the aging process.
As you can see, there are a lot of different components to this amazing service that Nightingale, New Jersey Eldercare Navigators provides. If you would like more information, please check our directory in the Modern Aging Show. We will be back after these messages.
Seeing is believing at the Meadows at Lawrence, the area's leading and most unique skilled nursing and long-term care community.
It's just a lovely feeling living here.
Delivering with a concierge patient-centric model, the authentic experience of this long-term care setting is taking patient and family satisfaction to the next level.
The people, the food, the care you get, it's all there.
The staff are lovely to us. It's more like your home.
It's very patient-centered, where the residents are their number one priority.
They're beautiful. They're so attentive about everything. And they love us. I know they love us because we love them.
Private accommodations, cottage living, and an intimate caregiving environment have distinguished this unique care model as one of a kind throughout the state of New Jersey and Pennsylvania.
We work as a team, giving the best care that we can. It's a home-like environment. You could really focus on the personal needs of the patient.
It has every amenity that I want, plenty of space for my clothes. And
No strict visitor hours, where families can come in and host parties and feel as part of the home.
Can I wake up at any time I wish? Yes, and I'm proof of that because I'm the last one up in the morning.
Deserved and available for the senior in your life. The redefined long-term experience at the Meadows at Lawrence awaits you.
It's like home, hon.
Hello, my name is Jim Tritola. I specialize in Medicare here in New Jersey and in 5 other states. We're getting into a very important part of the year where it's called the annual election period. So we want to talk about Medicare so we can help people. Medicare is a program that anyone in America who's 65 or older or has been disabled for 2 years can qualify to get a Medicare card. Medicare card is a Part A and B. We'll talk about that in a moment. It's a red, white, and blue card. Doesn't automatically come to you. When you are getting near Medicare, we'll talk about enrolling here, within 3 months of your birth month, you need to contact the Social Security office in the local area where you are, or you can go online to ssa.gov and you tell them you want to enroll in Medicare, Part A and Part B. So what's Part A? Part A is basically the hospitals. If you've worked for 10 years or 40 quarters in your working career, Part A is free. Part B is essentially the doctors or the medical side of it. Part B covers 80% of the bills. So when you hear 80%, that's not 100%. So you got to figure out how are you going to pay for the other 20%. That's where we get into different plans, which we can talk about. One side of it is a Medicare supplementary plan, where you pay a premium every month, and it helps cover that 20%. You also need a prescription, what they call a Part D, D is in drugs, plan, which helps with your prescription medicines. Another side of it, which you see a lot of ads about, is Medicare Advantage plans. They help cover that 20%, and they also include prescription drug coverage, and many of them have extra benefits like dental, vision, and hearing. Now, there's rules and requirements with each kind of plan, how they work, what they cover, and we'll be glad to go into that. My contact information is below, and I'll be very happy to help you. There's no charge for my consultation, as I'm compensated by all the insurance companies, so I truly am free to you. I look forward to helping you. Don't be sold, choose.
Hi, I'm Chris Bratton with Bratton Law Group. I've been practicing exclusively in estate planning, tax, elder law, and life care planning for about 22 years. And one of the questions that we get a lot is, am I eligible for Medicaid? It depends. So it depends on the state. Medicaid is a means-tested program as opposed to Medicare. It's also state-specific. The asset limitations can vary by state. For example, in New Jersey, your asset limitation if you're a single filer is $2,000. If you're a married couple filing for Medicaid, the asset limitation is $3,000. However, if there is a spousal couple and one of the spouses is applying for Medicaid, their asset limit is $2,000. The community spouse is entitled to something called a community spouse resource allowance. That is half of the assets of the couple, but it's subject to a ceiling, and that ceiling can change from year to year. One of the other questions that clients have is they're concerned they're going to lose their home. As long as the community spouse is residing in the home is going to be an excluded asset. So we don't have to worry about the home, losing the home to Medicaid. One of the things we do like to do, however, is make sure that the home is transferred over to that community spouse in case that community spouse were to pass away first. We don't want a lien placed on the home. If you have any questions, reach out to us at Bratton Law Group. We help protect what matters most.